Welcome to Dr. Mary Travel Best's 5 Steps to Solo Travel Guide, and this is a special health episode for women like you who need a little extra support traveling the world one woman at a time. I've been traveling solo since 1972, and now you can have the latest and best-selling book series, 5 Steps to Solo Travel Part B, a woman's guide to destinations in her prime. It's found on Amazon. Please share this travel health podcast with future travelers like you so you can make their trips the very healthy best, like Travel Best. Then rate and review it so others can find it and help bring a little bit of extra peace into the world, one person at a time. Get the right amount of sleep and exercise before your trip. That's going to boost your immunity. That very basic beginning will help you get healthy. And so I want to talk today about how can you be more healthy. I want to give you some information from the CDC. They have several checklist questions. So I want you to bring this to your doctor. I want you to think about these questions before you travel. Here's what you need to know and what you need to answer. The CDC has a very good website, and they've got the right questions. So the first question I want to ask, and you will want to know, when are you traveling? Make sure that you plan ahead, even months ahead, because immunizations can take a long time to take effect. How long will you be at each location? So that is information that your doctor and you should know as well. Where are you traveling? This is important because different destinations have different needs for immunization. Which countries are you visiting and in what order? And where within the country or countries will you be traveling is a question your doctor wants to know. She might ask you, are these destinations urban or rural? Your doctor might also ask, where will you be staying or sleeping during your trip? For example, you may be staying in a hotel with air conditioning. You may be staying in a screened cabin or in open air tents, or you may be staying with family or friends. So these are things to work out ahead of time. Also, what activities will you be doing during your trip? For example, if you go on a long bike ride, you may need other shots, such as a tetanus shot. Have you traveled internationally in the past? Think about this. When did you travel? And another question, how old are you? That could make a difference on what kind of vaccinations you get. Next question is, what vaccinations have you had before? And do you have or could you get a written record of your previous vaccinations? There is an official international certificate of immunization that contains a record of your vaccinations and immunizations for you to keep with your passport. It will help you when you have to identify when did you have these vaccinations and how many doses did you have of a particular vaccine. Doctors are going to want to know if you have any allergies, especially if you're allergic to eggs, latex, yeast, or mercury. And the doctor is also going to ask you a little bit about your medical history and your current health status. Remember at the beginning, I said lots of sleep and really good exercise routines. And the last question that I'd like to know, or your doctor would, is what medications are you currently taking or have you taken in the past 3 months? It's important that you know that. So another question that I've been asked is there a disease directory? Can I find that? And yes, there is. So the show notes have a link to the disease directory at CDC. You're going to find the most common diseases and where they are mostly found, plus immunizations. So let's get ready for your next healthy trip solo. Send a question or a travel tip to info@drmarytravelbest.com. Find 5 Steps to Solo Travel series on Amazon. And the show notes have those important details for you to find good health.
What's on your travel bucket list? Tell the doctor and her team of women who travel the world seeking the very best. Dr. Travel Best, that is.